So good afternoon and welcome to the Find the Spark Within podcast. My name is Kristen Collins and I am incredibly excited to be recording this podcast in front of a beautiful, very heart-based live audience. And with me today, and I just got chills when I said that, with me today is Dr. Carla Stanton, and I am speechless for the fact that I've had the opportunity to cross paths with you and that you are here in the United States from London. Welcome as our guest.
Yeah, thank you. It's a real pleasure to be here. Thank you, everybody.
And you have the coolest accent, and I can't wait to listen to it for the next 45 minutes. So, Dr. Stanton, I'd love to start with you being Dr. Stanton.
Right. Yeah.
Can you talk a little bit and share with us your journey to becoming a physician?
Okay. So, the reason actually that I wanted to become a physician was really because I actually lived with quite a few chronic conditions as a child. And so I kind of knew what that process was like. And honestly, the reason I really wanted to become a doctor was it bothered me that I couldn't understand it. And I wanted to be able to have power over it. So I figured, like, what better way than to go to medical school and acquire all those tools to look after myself and ultimately my family, people I loved. So, because, whenever, has anyone here experienced a health condition or know someone who does? I mean, there's no other time that you feel more uncertain than when your health is called into question. So that uncertainty really shook me and I wanted control over that. And that was really the root cause as to why I wanted to go and understand. And I always found it fascinating, how the body works. I always kind of knew that. I remember even as a child finding it fascinating that, you can have an injury, I can graze my arm, and without me putting any of my conscious attention on it, that will heal. And I knew it was really complex, but I didn't understand it. And so I wanted to understand it. And so that was kind of one of the reasons that I wanted to go and acquire this knowledge.
I did not really know that about you. And it's very inspiring to me because when I would go to the doctor, I would say, why? Like when I woke up from my exploratory surgery and found out I had cancer, and I looked at the resident and who was attending to me and I said, why did I get cancer? And she laughed at me and she goes, well, Kristen, if I knew that, I'd be a billionaire. So that curiosity, I was constantly with my chronic diseases asking the why. But I didn't go to med school. So now you're a doctor and you're practicing. And what was it like to practice medicine looking for that root cause answer?
Yeah, it was quite tough, actually. Like I acquired all this knowledge, and I remember as soon as I entered the medical wards, I experienced anyway a bit of a disconnect, a bit of a dissonance. I could see quite a lot of pain and suffering around me from our patients. I could see it in my colleagues, and so it didn't feel innately like a place of healing. And so that kind of was just something that consciously at the time I wasn't really aware of. Like, you just do what you're trained to do, you just crack on and you do the best that you can. And so I was working in this system just with this knowing that something just wasn't right. And from the UK, in your medical training, you have the privilege of working in lots of different specialties. It's quite prolonged. So you do pediatrics and oncology and ER medicine. So you get to see a real spectrum. And so I saw a lot, and I saw how acute care was just so elegant, incredible. But I also saw how chronic care was failing, and that ultimately chronic care or chronic disease can lead to acute disease. And so that looked to me like the root cause of like, okay, well, let's see what we can do with this. And so I ended up becoming a family medicine doctor. And so a lot of the patients around me, they have chronic disease, and I could see the stress in them. I could see the stress in me, but it bothered me that despite my training, I couldn't quite understand the connection of why is it that they're getting sick. And I knew that, I had eczema and asthma, and I took steroids, or, so that's a stress hormone. So you're taking a stress hormone for a condition, and yet the link wasn't quite there as to why that was and if I could do anything about it. And for my patients too.
Sure.
Yeah.
So here you are working within a profession, knowing that you're not getting to root and having a lot of questions.
Yeah.
what was your next step? What was your tipping point?
Yeah. Well, it's funny because at the time, because you have such incredible training and, you have this expectation that you should have the answer.
Sure.
And it's like people look to you for the answer and say, oh, you're a doctor, And so you sort of think, well, yeah, I should know. I don't know. But and then you feel like it's a failing. This was my experience. I felt like there was a party of failing on my part. Like I wasn't able to do something and it was me. And so it actually made me feel quite low. And at the time, I didn't really know why I wasn't happy. Like, I at the age of 36 or so, I became a family doctor and I joined a practice and I'd bought into the partnership and it was a really lovely environment and I've done everything right. But it was just like something's not right. So I actually ended up initially going on a bit of a personal development journey because I didn't know what was wrong. I didn't consciously understand it. And that led me on a really interesting path of understanding the power of belief on health. Really understanding actually, okay, so how stress affects the body, how the body affects the brain affects the body, and this intimate link that's always going on behind our conscious awareness. And then how we can actually change it with the right tools.
Yeah. So many things right there. And I wonder how everyone else resonated for this. Something's off. I think I'm doing it right. I have it pretty good, right? I'm in this family practice. It's a nice environment, but something's off. So I applaud you for connecting with that discomfort. We, as a collective, talk a lot about sitting in the now and just feeling and allowing the discomfort and not trying to change it, but to connect with it. And another learning I had with medicine and my own health was I had no idea I was responsible for it. I thought, well, I'll go to the doctor, they will fix me, or they will medicate me, or they'll tell me what to do. One of my big ahas was like, wait, what? I'm in charge of my own health, and it is related to things like my stress level. So why it's so amazing, and I'm so grateful that you speak from this lens, is that you are a very successful trained doctor, not a layhuman, right? And you understand that there is connectivity to your mind.
Yes.
Yes. So let's go there, if you don't mind, because this is the meat of the passion. What is the connection of the mind to our physical body?
Yeah. Well, there's never a moment when there's not a communication between your mind and your body. It's in constant communication. And if I were to put a heart rate monitor on you right now, for example, we could see by the way your heart's beating moment to moment, we could see how that is a reflection of what you're thinking, what you're feeling, how you're behaving. And so this is constantly on a feedback loop. And so how you think, if you think an unhappy thought, you feel unhappy. The moment your body starts to feel unhappy, it sends a message back to the brain and you start to think more unhappy thoughts. And you can go on this cycle of thinking and feeling and feeling and thinking. So thoughts are the language of the brain and feelings are the language of the body. How you think and how you feel creates your state of being. And so understanding that is a constant, continual loop that's going on behind our conscious awareness and is affecting us biochemically. I mean, every time you have a thought, you make a chemical. And that's a feeling. You feel that chemical. You feel that chemistry in your body. And so how is it that we used to think that there is no connection going on between one and the other? And what I loved learning about the heart math tools is that actually the heart is sending more information to the brain than the brain is sending to the heart. And so I remember being taught like that the brain rules the body, it's in charge. But actually there's so much information in our body that's ascending, which can really inform us to make better choices. And if we can start to become aware of our body, I mean, I don't know about you, but in medical school and when I was training, I was taught to like cut this off. And sometimes it's so hard and uncomfortable. You do have to do that in the moment. Sure, but that emotion is always stored somewhere. And unless you have the tools to sit down with it and really acknowledge it, we can't fool our physiology. It's there behind our conscious awareness. And it's really our duty to start to bring some compassion to that intelligence and start to pay attention to it and evolve it, like energy, emotion. So that's really the power of like this constant reaction that's going on. And so that was really fascinating when I started to understand. It makes sense. It makes sense. And we talk about it in medicine like white coat hypertension. And it's because the brain is an anticipating machine. As soon as you think about the thought of having your blood pressure taken, you're having a test, your brain is the anticipating machine creates a stress response. And that's why your blood pressure goes up. So we know that it's measured physiologically. But that's just quite an extreme. That's kind of something that we can measure. When you're feeling stressed, you measure blood pressure goes up, your heart rate's up faster. But imagine if you're constantly having stressful thoughts, even just quite low level, you're creating a little bit of adrenaline, a little bit of cortisol in the body. That's feeding more thoughts of stress constantly going on. And over time, it could become unconscious. Mm-hmm. And so that can create disharmony, dis-ease, dysregulation in the body long term.
What can we do about that?
Well, I think the most important thing is to start to become aware of it. Mm-hmm. Mm-hmm. Absolutely. So, 95% of who we are by the time we're 35 years old is a set of memorized thoughts, automatic emotional reactions, unconscious habits and behaviors, hardwired attitudes, beliefs and perceptions that function just like a computer program. And so if 95% of who we are is a program, then it means then that we just have to start to become conscious of how unconscious we are. And really that begins with sitting down with it and beginning to become the observer of ourselves.
Is there if you were still practicing, is there a technique that you would encourage someone who just came to this awareness and was like, wait, what? 95% of me is pre-programmed. What would be an entry into connecting with the now?
Yeah. I mean, I think really simply what you can do is, because of the way we're uniquely wired, the power of breath is really, really underrated, but just hugely transformative. Because of the vagus nerve, because of how we're wired, most of the time our breathing is under unconscious control, isn't it? We're not thinking about how we're breathing. But we have the ability to change how we breathe just by becoming consciously aware of it. And actually the way our heart beats moment to moment is influenced by our breathing. So if I take slower, deeper breaths, my heart will get a message from my body to say, oh, everything's actually safe. It's all okay. It will start to beat in a much more coherent way. That information's being sent to the brain. My brain starts to get out of that sort of stress response when, if you're ever stressed, it's hard to focus on things, right? So it actually quietens down the mind. It lowers the brainwave frequency. It slows your brain down and you can begin to focus on things. Actually, it loads from your beta to alpha brainwave patterns just by breathing a little deeper and slower than you normally do. So just by beginning to become conscious of your breathing and consciously slowing it down for a little deeper and a little slower than you normally do is a really powerful way to take charge of your energy, to change your physiology at will. And just that process alone, just 5 minutes a day of just sitting and watching your breathing and pacing your breathing, not only will it allow you to feel more centered and calm, but it also increases your heart rate variability. So we know that heart rate variability is like one of the most sensitive markers of health and longevity.
And I don't know that we all know that. So can we dive a little bit into heart rate variability in English for we lay people?
Yeah, absolutely. Yeah, absolutely. So, we used to think that the heart beats like a metronome, like steady, regular. That's not true at all. Your heart is constantly speeding up or slowing down. And it does that according to the environment that you're in, how you're thinking, how you're acting, how you're feeling. It's responding constantly to what's going on, and so it should. So it makes sense that if you suddenly have to run for the bus or whatever, it should speed up, right? So it's constantly changing rate, moment to moment. And so the extent of variation, the extent that it speeds up and slows down is called your heart rate variability. And it's a direct reflection of something called your autonomic nervous system. This is the entire nervous system which is going on behind our conscious awareness, that's beating your heart, that's filtering your kidneys, that's creating order in your body. And so it's intimately related to that. And so when you can begin to just actually by the power of breathing, when you change how you breathe, that actually creates more of a coherence in your heart rate variability. So it speeds up and it slows down in a much more coherent way. So when we are under the gun, under the hormones of stress, our heart beats in a very incoherent pattern, and it feels incoherent, doesn't it? It feels chaotic when you're living in stress. And so just by beginning to become conscious of your breathing and slow it down, that increases the coherence of your heart rhythms, increases your heart rate variability, and therefore increases the capacity in your body to heal, to think clearly, to communicate, to collaborate. It actually turns on your brain into a much more highly functioning organ. So not only does it make you healthier, but it also helps you like execute and perform better. So heart rate variability is really important for us to be aware of, and it's classically it reduces between 2 to 5% per year. So you're born with a really high heart rate variability, and I don't know if there's anyone's had children, or they often put a heart rate monitor on the baby, don't they? And they're measuring heart rate variability. They're looking for any sort of distress in the baby, and they know when the heart rate variability drops, it's a sign of distress, and it's a time to maybe think about birthing the child. So, but this goes on throughout our lives. And when we are constantly under the gun of the hormones of stress and we are interacting with our environment and our heart starts to beat more incoherently, it makes sense that over time our heart rate variability will drop. But if we can learn techniques to begin to start to breathe more deeply, to begin to become more conscious of how we're thinking, how we're acting and feeling, and change it, we can actually influence our heart rate variability. And therefore, our brain starts to work better, our body starts to work better, we feel better, and our heart rate variability goes up, which is a marker of longevity, which makes sense. So it's something that we have control over. And if you do it often enough, that can become the new habit. And so we've had people in Dr. Joe Dispenza's work where their natural state is to have a very coherent heart rhythm. They are sitting in a lecture and their heart is beating beautifully coherently. It's just now who they are. And maybe 5-10 years ago, they were living in a stressful environment, reacting to the challenges of their environment, and their heart was beating very incoherently. So it just shows the power of these tools to completely transform your autonomic nervous system, your health, and your heart.
So did the stresses in the life of these people who have this beautiful, coherent heart, do you think the exterior stresses had changed?
Yeah, it's a really good question. So, I mean, our brain is a reflection of our environment.
Thank you.
So, depending on our environment, we will experience stresses. I mean, we are human beings. This is not about pretending that the world is out full of fluffy clouds. We are going to react to our environment. What they learn is that, yes, I'm going to go there. I'm going to go and turn on the stress response. Of course I am. But I'm going to learn how to become consciously aware of when I'm there and when I'm not. I'm starting to pay attention to the feedback from my body. So I become consciously aware as soon as I notice stress, and then I do a technique to instantly create more order in my body. And then I can start to move my body more into a state of coherence. And so then over time, what that means is in the same environment with the same triggers, they might react. But the time that they will react won't go on for so long. We call that the refractory period. So they learn to shorten the refractory period so that they're going to go there, but they're not going to go there for so long. And it means that the body and the brain will recover and they have more capacity to get on with their day. And it just means you're not just, wiped by the end of the day and you're just reaching for that glass of wine or whatever it is. You've actually been able to constantly top up your battery through these techniques through the day, even if you've had a really tough day.
Dr. Stanton, I think that is a linchpin, like that is a cornerstone of this awareness, is that there's so much, especially now with the instant awareness through social media and news, there's vast, huge things happening that are really upsetting, things either in your personal life all the way to global issues, and it can be paralyzing. And so it's the work for me isn't, I can't control all that. I can't change all that. And actually the only thing I can control is how I show up and experience that moment. So what you just shared of it's still about stressors, but it's about how am I reacting to them? How quickly am I getting back to center? So thank you for that. I'm like, oh, I'm so glad we captured that because I think that's really cornerstone. I want to regress just a smidge. What are some ways physically that stress can manifest into illness within the body when you're incoherent? And I want to understand a little bit better about incoherence versus coherence and how that physically shows up in body.
Yeah. So they can show up in a few ways.
Yeah, that's what I thought.
So it can show up physiologically. So we've all been stressed where our palms start to get a bit sweaty, or our throat gets a bit dry, or heart's beating a bit fast, so we get butterflies. So we can be aware of these physiological changes going on in the moment. And then, and over time, I don't know if you've had at the end of the day, like your muscles tense up and you can just feel that you're carrying all this stress in the body. And so that's physiologically what can happen short term. And then obviously emotionally, when your body goes into chaos, it feels chaotic and it feels unpleasant. And so we can create quite negative emotions through that physiological shift. Your body, like you're plugged in with your five senses, it's noticing there's something not right, there's stress, your physiology shifts, and that feeds back to connect to your brain, to create an emotion of like, this isn't safe. And you feel unsafe and you feel fearful or anxious. And then that will influence your thoughts. So you'll start to think, what's going on? This doesn't feel right. What should I do? I don't know what I'm doing. All those sorts of, fearful thoughts that we can have. So that's how it can show up short term. Oh, and all people can tolerate short term stress. Like we're all going to go there. But the challenge is that as human beings, we have the unique privilege of making thought more real than anything else. Right? So because of the size of the frontal lobe, that's 40% of the real estate of your entire brain. You can have a thought, and because the brain and body is so objective, it doesn't know the difference between the real life experience and the experience you create by thought alone. To the body, it's the same. When you get captured by a fearful thought, even when you're not in a fearful environment, you can create that chemistry in your physiology by thought alone. So even separate from the experience. Now, animals don't do that. Like the zebra gets chased by the lion and then it goes back to grazing and it's fine and it's just eating and it's recovered. But we will think about it and we'll feel and think and feel. So you'll allow that to go on for a long period of time. And that might happen for months. And people will notice that there's a shift in you. And they'll say, what's happened to her? What's up with it? And I'll say, this thing happened like a few months ago. And you'll say, okay, it's because of this thing, this opportunity that happened to them, whatever. But if you don't become conscious of that and it goes on for months or years, that becomes a personality trait. And you'll say to that person, wow, your friend or something, you'll say, wow, that person's really angry. Why are they so angry? And you'll say, wow, this thing happened to them 15 years ago. And all that's happening is they're having a prolonged emotional, physiological reaction to that event that they're replaying. They're thinking and feeling about it for years on end. And that becomes their normal state of being. They don't even know that they're angry. It's just who they are. Just like you don't even know if you're a guilty person. It's just who you are. It feels right. And if you live in that physiological state for a prolonged period of time, it may become normal to you. But yet behind the scenes of your conscious awareness is creating dysregulation in the body. So it's creating autonomic dysregulation, the autonomic nervous system that controls how your heart is beating and filters your kidneys. So that becomes dysregulated.
And what happens to your body when you become dysregulated, right?
So all the functions that are running outside our conscious awareness, it's so unbelievably complex how our bodies even function. The trillions of cells that we have in our body, the billions of reactions that are going on in every cell. And so that's being controlled under your autonomic nervous system. And so if there's dysregulation, just like, in a company, if there's dysregulation between the bodies, nothing's talking to one another, then you get breakdown and you get dis-ease. And initially you'll start off with this kind of cortisol rush, living in stress. But over time, there's only so much time that you can live in that state. And the cortisol depletes and you start to get that burnout and you start to get that lack of energy. And this is why some people with inflammatory conditions like I had like eczema and asthma, you have to take steroids because that cortisol is being used up. And you are in the state of dysregulation, dis-ease. And so that's where you are more prone to getting mentally, physically, emotionally unwell.
So are you able to speak on the connection through the autonomic nervous system to gut health?
Yeah. I mean, you've probably heard of the autonomic nervous system in the sense that we have the fight or flight response. There's two branches of the autonomic nervous system, the fight or flight response, sympathetic nervous system, and then there's the parasympathetic nervous system, and rest and digest, feed and breathe, right? So the clue's in the name, like rest and digest, feed and breathe. And so we live in two states of mind and body. We either live in that state of survival, go, 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 or we live in a state of creation, parasympathetic, feed and breathe. And so when we're constantly under the gun of hormones of stress, we have a different physiological response. The time now is that the signature of stress is your life is in danger. And that's what it means. And so it's kept our species alive for hundreds of thousands of years. It's served a great purpose. And what it does is it kind of is interested in short-term projects, right? It needs to divert all the energy to your muscles, getting you ready to run and fight. And it's going to divert all the blood from your viscera, from your gut. It's not a time to digest food. It's not a time to assimilate. It's not a time to nourish. That's a long-term project. Short-term, you just need to go to the heart, beat it really quickly, go to the muscle so you can run and fight. And that's fine, short-term.
Sure.
But you need to be able to recover so that you can go into that parasympathetic, that feed and breathe, rest and digest, so that that blood can then be diverted back to your digestive system to start to nourish you and create and repair and restore. And so when you're constantly influenced by stress, it makes sense. I mean, IBS, irritable bowel syndrome, is a very common condition, and I've suffered with it back in the day, and I've noticed that it's worse when I'm stressed. And it makes sense. There's not so much blood going to my digestive organs. I can't digest so effectively. The microbiome, the bacteria that exist within us, which we need to digest our food, are also being affected and influenced. So we actually start to not digest so well. And we need that food to exist. I mean, everything that we consume creates every cell of our body. So it makes sense that we need to be able to focus on and nourishing our gut. And many of you probably heard about the gut-brain connection. There's a huge amount of information neurologically that's being sent from the gut to the brain. So just by being aware of your physiology and your extent of stress, you can influence it with the right techniques and actually increase capacity of your digestive system and reduce those incidences of, even just bloating and just irritation, but just actually to support you to assimilate.
In your opinion, from a medical perspective, can we heal our gut if it's already been injured?
Yes, absolutely. Yeah. I mean, so I love what you said before, that you were saying how I realized that when you got sick, and it was like, okay, usually we outsource it to doctors, which I want to talk a bit more about that. So usually it's outsourced. Oh no, I'm going to have to take control of this. And so what we teach in this work, which is truly empowering, which I was never taught, was like, we actually have autonomy over this beautiful piece of machinery that we were given, this elegant device that we don't get taught how to use. And that if we can start to take ownership and look after it and pay attention to how we think, how we act, and how we feel, we can actually reverse things that we have created unconsciously through those traumatic experiences, through things that have happened to us in our lives. And it's appropriate that we go there. Like, we're all going to have big challenges in our lives. I mean, absolutely. But just having the tools, if we want to take ownership and really give our body new information, that allows things to turn around. But I would have given you a different answer a few years ago.
You and everyone else.
I didn't have that belief, because in a hospital setting, you don't always see success. You don't always see people come in and heal. And so you get quite a skewed opinion of what health is and what is possible. And so I had a limited idea of what was truly possible in terms of personal change and transformation of health. But through this work, I continue to have my beliefs changed about what is possible with conditions that you think were life-limiting. Were going to be a chronic dis-ease that in convention doesn't ever go away.
Well, and, to their defense, it's not how you're trained, it's not how you're reimbursed, and you have 4 minutes. So what can you solve in 4 minutes? And so my seemingly unrelated health issues since birth, I put together, finally after 50 some odd years, I'm like, wow, they were all autoimmune related. And then I have beautiful people who are like, well, how do I heal my gut? How do I heal my gut? What should I eat? Which of course is important and to feed the positive bacteria in the microbiome. But it really became me calming my mind because I was beating up my gut and to a point of my poor digestive system was shot. So when we have maybe experiences that have occurred that are now stored in our subconscious way of being, and we're not even aware that they're still hanging out with us, it's just that stored energy, how would you advise or guide people? Because I get this question not daily, I get it hourly. How do I go back and unstick it? How do I go ahead? And by the way, I don't even really want to revisit it.
Right.
Do we have to revisit it? How do we get rid of it? Yeah. Talk to me about that.
Yeah. Well, certainly in the work that we teach, particularly with Dr. Joe Dispenza, is that we don't have to necessarily go back to the event, back to the trauma.
Did everyone hear that? That's like the best news this year. We don't have to go back to the trauma. Thank you.
So the trauma can give us insight, intellectual insight and understanding, and that can be really valuable. Of course it can. But when you have a traumatic event in your life, it shifts you physiologically. You get a huge quotient of shift biochemically. And the brain freezes a frame and takes a snapshot picture, which is called a long-term memory. And just as I said before, because we can make thought more real than anything else, we can then think about that problem and feel and think and feel. And we do this looping for years and years on end. And so it becomes an unconscious process, right? So in order to change that, sometimes we don't even know. And I've had these certain things that have happened to me that, I don't know what the root cause was of me developing eczema at 3 months or developing asthma in my early sort of teens or chronic viral fatigue. But I have ideas, but I haven't spent ages analyzing within the emotion because that will just keep me in the emotion. So you have to get outside of the emotion. You have to get beyond the emotion. And so that's really the key. It's about becoming so familiar with those familiar emotions and deciding whether you want them in your future or not.
Love, absolutely love that. So, and I do want to go into the transference of stress through pregnancy and coming out. How old were you when you first knew you had eczema?
I got it at 3 months.
Yeah, I came out of the womb with eczema.
Oh, you did? Yeah.
And that was one of the first welcome to this world that I was gifted. So how did I have eczema? How did you have eczema at 3 months? And so I don't agree. We don't have to spend time on that. It's just an interesting concept. So where I want to go with that now is energy. Recently, we've spent a lot of time. Emotion is energy in motion, and a dis-ease can be created because of stuck emotion. So talk to us about energy and where that plays in the medical field or just in your practice in general.
Yeah. Energy, obviously we are energetic beings, right?
Not necessarily obviously, right? So right? I agree.
But it depends what your association with energy is. So some people think, oh, energy, but we are, right?
That.
But we take in energy through a form of food. We convert it into chemical energy and release it as heat. And so we are constantly in a physical way consuming and releasing energy. So we are energetic beings. There's no way that you can kind of agree or disagree with that. But, there's certain things that as soon as you start to talk about emotions and energy, because I always understood that, stress in terms of what creates disease when we're talking about eczema, like how can I take control of that? And I absolutely did the diets and things like that, which support us.
Sure.
And again, that's information, that's energy that we're taking into our system. So let's give some different information to the body. So we have 3 different types of stress. We have physical stress, chemical stress, and emotional stress. So can I correct my physical stresses, my chemical stresses through food, through how I'm moving, all super important. But the emotional stress piece can be harder, particularly for me, to address, particularly if it's unconscious and it becomes a habit. So when you think about it, whenever you have a dis-ease or condition, you can address the chemical stress, you can address the physical stress, but a lot ultimately of dis-ease, if you break your leg, it causes emotional stress, doesn't it? If you can't work, it's causing pain, you get frustrated. So it all culminates in that emotional distress, and that creates dysregulation in the body. The energy that you're consuming and manufacturing is influenced by that, and it becomes dysfunctional. So your energy levels go down, and we've all experienced when we are sick that our energy goes down. So you can explain it from a simple physiological perspective. That totally makes sense. Were you talking about other kinds of?
No, it's beautiful. So is there the opportunity to influence our individual energy?
Yeah, absolutely. So we all know that, depending on our environments, we can be different people, can't we? Our energy levels can be different. So being aware of our environment and its influence is really important.
Yeah.
And so knowing what environments are nourishing and not so nourishing or depleting is really important to maintain our energy. Knowing about how our body is influenced by energy, what foods support our body, what movements support my body. It's just this constant paying attention to how am I feeling. We're like checking in, like, I don't know if you call it a dipstick on your car, as we use in the UK. But if you're checking the oil or, you're checking the lights, you're constantly getting feedback from your body. So just paying attention to what works for you to maintain that level of energy. But it's really about the environment, and that's kind of the people, the places, objects and things. So we know that there's a certain energy drop or heightening that we get with certain people, right?
Oh yeah.
Certain places that we walk into, certain objects, our phone maybe, or our car or whatever, and things. So it's just having that awareness as to, is this loving to me? Is this supporting my energy, or is it not? And is there a way do I need to spend less of my time in this environment or not?
Yeah.
There's always going to be times where we have to be in environment.
Exactly. That's exactly where I was going to go, because right now there's just a lot of chaos, or at least I'm more aware of the chaos. I question that as well, because I think historically there's always been the chaos. I just didn't have such immediate access to it. So I think for resilience and burnout, and I'm not personally interested in being baseline. Like, I didn't show up here just to be good. Like, I want to have a vibrant, healthy, optimal experience of well-being, not just not be sick, right? So to do that within a lot of stimulation, and it's not, trust me, there are many times I'm like, can I just remove myself and go climb that mountain and, eat granola and not take a shower? This would be fabulous. But reality, and I want to stay leaning in. How do we, and I want to, because I want to open it up to questions about how I want to lead into your research with that as a foundational question. You chose to leave your practice per se, and now you're putting all of you into this research because there's a lot of feedback about, well, is this science-based? And what's super interesting, if I may, before I ask you the question, I just crossed with a book that was written by Dr. Ben Siegel, who's a surgeon up at Yale. It was written in the 80s. It was written in the 80s, and I was operating on at Yale in the 90s. And this poor guy has been up there understanding disease and the mind-body connection for how many decades is that? 4 or 5 decades, like a really long time. Not hated, but just like nobody embraced him. He couldn't get published. Nobody would publish his findings. So this information is out there. It's just non-traditional for our current tradition. And then how's our health right now? So you, my beautiful friend, have decided that you're going to lean into this space and research exactly what we're talking about to aid people to be able to open their conscious and subconscious thinking. Talk to me about your research and what it is that you are looking to study.
Yeah, so certainly HeartMath and Dr. Joe Dispenza have done a huge body of work. HeartMath have done mostly focusing on the influence of the heart, right? How the heart rhythms are influenced under stress. But they also look at other biomarkers like cortisol, which is the stress hormone, DHEA. Has anyone heard of that? Or takes it, dihydroepiandrosterone. So that is that's the kind of you think of it as the opposite of cortisol. So the more cortisol you have, the less DHEA. The more DHEA, the less cortisol, and it's a feel good hormone. It's a very rejuvenating. They call it the elixir of youth. Okay, so but you can measure that in your saliva and other ways. And then obviously you can do questionnaire data. So you can ask for their subjective experience and marry that with the objective measurements of what's the level of, their oxytocin, what's the level of their DHEA, what's the level of their cortisol. So they've looked at huge different populations and they've looked to see, well, if we implement these techniques, we'll take them at their baseline. Okay, what's normal for them? What's their baseline? What are their normal levels of cortisol, DHA? What's their baseline of heart rate variability? And then we implement these techniques to them. Not only do they use them in real time when they're challenged, but actually if you consistently do them over time, in fact, the research shows from HeartMath that just 5 minutes twice a day over 2 months, and as little as that, 10 minutes a day, you can change your baseline heart rate variability. So not only is your heart rate variability greater, but the energy, the order in your nervous system is better, but your cortisol levels are down, your DHEA is up. And so you can transform your biochemistry. And that also marries with the questionnaire data. So you'll start at the beginning of that and say, what will you experience? How much stress are you experiencing in your life? What physiological symptoms are you experiencing? And then at the end of those 2 months, you can redo it and you see the shift. And that provides objective data that you can't really argue with. You show the difference pre and post. And then you can take another group and compare it with a similar group of individuals as a control.
Sure.
And so they've done a lot of work on that and have shown the impact of this in many different settings. And Dr. Joe Dispenza has been doing more and more research over the years. So he started to self-fund research more than a decade ago because people would come to his events or do his work and they'd experience these huge transformations, and he wanted to be able to understand it. So information to teach transformation. The more that you can understand the information, that's better information to teach transformation. And so he started to self-fund brain scans. So he would have people who would typically come to an event. This is where you step out of your normal environment and you can take some real time to sit with you and learn the tools of change and transformation. So it's a really immersive experience. So he would do brain scans at the beginning of the event and the end of the event. So he's seeing what compartments of the brain are talking to one another, whether they're beginning to synchronize and create more coherence in the brain. We would look at the heart as well. So I've had the privilege of looking at these hearts and how they can change in just 7 days and things that I would never have thought possible, like in the standard medical model. So looking at heart rhythms and then and certain biomarkers. But now, since they partnered with UCSD, they're looking at so many different markers. Essentially, we're seeing all these changes during these 7 days now of these events, but we want to know exactly what's going on at the cellular level. And so we do questionnaire data. We take your saliva, we take your urine, we even take your stool. So we're looking at microbiome changes. So it's really a case of like a net to try and capture what are those key factors that are creating that transformation, that person who looks different at the end of 7 days. So that's a part that UCSD are now intimately involved in and is really, truly exciting. And
UCSD, University of California, San Diego.
Yeah.
Just making sure my acronym was correct. One more question, and then I want to open it up. How does our own mental health or emotional health connect to our journey of aging?
Yeah, it's a really, really good question. In terms of journey of aging, do you mean just the natural course of our...
Yeah, our the breakdown of our bodies, how we physically appear. Yeah.
No, absolutely. So, I mean, as I was saying before, if you get into this habit of thinking, unhelpful or depleting thoughts and feeling depleted. And that brain is always paying attention to the body and starts to think more insecure thoughts or unhappy thoughts or unhelpful thoughts. So constantly, if you're playing this loop, which creates dis-ease or dysregulation in the body, over time, that will influence your physiology and your health. And, we live stressful lives and we have traumas in our lives. And of course we do, we're human beings. And so we are going to react and we are going to respond. And so, we will naturally see this aging process through our lives. But the interesting part is, why is it that some people age quicker than others? And many people have talked, I don't know if you've heard about the blue zones, and there's certain pockets in areas of the world where, they have more centenarians, more people living beyond the age of 100. And they're looking at what are they doing? What's different about them? And there's a few things they've thought about in terms of their stressors, like what are they eating, like the chemical stressors, toxins, pollutants. What are their physical stresses? Well, actually, they're not doing formal exercise. They're doing informal, functional exercise. So they're not getting stressed that I haven't gone to the gym for 30 minutes or an hour today. They're actually integrating into their natural day. And then the emotional stresses. And one of the biggest things is their sense of connectivity and meaning and community.
They're moi. I think it's moi. I have a funny story for you. The chief medical officer for Blue Zones is a colleague and friend of many of us. And I did invite him to connect with us today, but he's in Europe. And I said, well, we're recording it, so we'll send it to you, Dr. Weiss. So that's super cool. I want to open it up for questions, and because I'm sure there's a few out there. Would anyone like to ask? Yes, Jim.
I have gut issues for 50 years. And only recently, the beginning where I've started, Kristen's been helping me. But my question is this: I like my IPAs. So, I'm sorry, but like a beer. One weekend I can eat horribly wrong pizza, M&Ms, beers, and I feel great, and my poops are great. And the next time I have the same thing, and I'm horrible. So, to me, it tells me it's not physical. And I've had some tragedy that I keep playing over in my head. How can I stop that?
Yeah, thank you. Thanks for your question. So, I mean, when we think about any disharmony that's going on, it's important to think about those three areas of stress. So the physical stresses, the chemical stresses, and the emotional stresses. And so taking some time with your physician or your medical person to try and identify those and see what's really supporting you physically and chemically is super important. And just a point on the chemistry, when we eat, the gut is such an emotional organ. But if you think about it, it's the first kind of port of call to the external environment. It takes quite a lot of stresses, doesn't it? It has to take in information from the environment and decide whether it's safe or not. Is this friend or is this foe? And it's working really, really hard. And there's a lot of really complex immune processes that are going on within our gut. And kind of the turnover, when we talk about immunoglobulins, and just to touch on the point of sometimes I eat this and I feel fine, and sometimes on another occasion I'll eat this and I'll feel terrible. We don't always get an immediate immune or response to food. It can be delayed. So up to 21 days. So I don't know if any of you have heard of the elimination diet. When you're trying to identify what's triggering my gut, you have an elimination diet. And that's because the immunoglobulins, the IgG, that it takes 21 days to turn over. So we have to do 3 weeks to exclude all those triggers before we slowly introduce them. And so sometimes it's not an immediate response that we'll get. It's not even 24 hours. So there's that chemical stress that's going on, but also on top of that, as you intimated to as well, there's that emotional piece that, we will all have had events in our lives, in utero, I'm sure you and me both, right?
Yes.
With the eczema that we had, that we didn't play a part in. We were in a fetus, or we were young and our parents are doing the best job they can, and it just happens, and we just take in all this information Our subconscious is wide open, and we respond and we react. And of course we do. We're human beings and we're fragile. And so that's going to happen. But the question is, when we get older, how can we begin to start to change it? When we have, the beauty of our analytical mind, our autonomy to begin to change it. And it is a process of sitting down and starting to become really conscious of those unconscious thoughts. How am I thinking every day? What are those repetitious thoughts that I have each and every day? We have between 60 to 70,000 thoughts in one day. It's a lot. Okay. And it's a lot. Yeah. And 90% of those thoughts are the same thoughts as they were the day before. 90%, most people. And it makes sense then, if you're thinking the same way each and every day, your life, your physiology will stay the same. Because the same thought will always lead to the same choice. The same choice will always lead to the same behavior. The same behavior will always create the same experience. And that same experience will produce those same familiar feelings and emotions. And those same familiar feelings and emotions that we experience each and every day drive those even more of those same thoughts. And our biology, our neurocircuitry, our neurochemistry, our hormones, and even our genetic expression stays the same because we stay the same. This is something that Dr. Joe Dispenza talks a lot about. So what if we were to learn some new information? And since learning is foraging new synaptic connections in your brain, every time you have a new thought, you're foraging these new synaptic connections in your brain. That's what learning is. So learning is foraging new synaptic connections, and remembering is maintaining and sustaining those connections. So what if you were to acquire some new information, learn some new things about how you can actually become conscious of those unconscious thoughts, actions, and feelings? Is it possible that that new information can lead to some new thoughts? Is that possible? Right? And then those new thoughts can lead to some new choices. And those new choices could lead to some new behaviors. And those new behaviors could create some new experiences. And those new experiences will produce some new emotions. And those new emotions will drive even more new thoughts. I can change. Wow, I feel different. And that's called evolution. So this process of becoming so conscious of our unconscious thoughts, actions, and feelings, taking time to sit down with compassion and list out, how am I thinking every day? What are the actions that I do? If I were to watch myself, what would I see myself do? What do other people see me do? Because most of the time we're not paying attention to that. And how am I feeling? Really, how am I feeling? And do I want these thoughts, actions, and feelings in my future or not? And if I don't, how can I start to recondition my body with new thoughts, new actions, and new feelings? And it's a process. It's a process. So we have, as we said, 60 to 70,000 thoughts in one day. We're not going to fix all of them like in one go, right? And some of them are incredible thoughts that we need. They help us function. So it's a process of starting to become conscious of them and planning our day. And this is the power of mental rehearsal. We sit down and we rehearse. How am I going to think? How am I going to act? How am I going to feel? Who am I going to be today? What's going to be different? What are going to be the experiences? And when we do that, we're teaching our body emotionally what our mind has intellectually understood, and we're changing our physiology ahead of the experience. We actually lay down the neural circuitry before the experience so that it's already happened before we even slip into our day. And that's what Dr. Joan teaches in meditation. So that's where meditation could be so helpful to do. And actually one of the events that we're supporting will give you all the tools to understand that.
Yeah, we're very blessed that, as my nickname for Carla is Dr. London, because she does reside in London. Dr. Stanton is actually going to come back to town November 2nd and 3rd, and we're going to be offering the Neurochange Solutions workshop for all who are interested in rewiring subconscious thinking. Yes, two gentlemen in the back. You guys fight over who gets it first. Two gentlemen in healthcare, by the way. This is very exciting.
Chris and Dr. Stanton, thank you for inviting us all into a conversation discussion. And what I'm hearing is that we have to learn how to be happy. We have to learn how to take care of ourselves internally and own that outcome. As what we do learn though, as humans, is how to deal with stresses, but through vehicles like alcohol, drugs, recreational or prescription. of food. I'm a sugar addict, so that helps me with my stresses, and it helps us feel fine for a small time. And then we realize that these aren't the answers. My question to you is, healthcare systems, right? We call ourselves healthcare systems, and I sit on the board of a healthcare system. We're really sick care systems. We're not really taking care of someone preventively, right? In most cases. And doctors are trained to take care of sick, not health. So is there a role for healthcare systems to really teach us how to meditate or how to internalize or how to breathe? Some of the things that you're referring to, so we can actually take control of ourselves without the industries that are trying to sell us, whether it's booze or drugs or food or all these other things that say, oh, do this, and you'll take care of your stress. Is there a role for healthcare systems to be able to do this?
1,000%. Yeah, absolutely. I mean, we are so conditioned to take something exogenous from outside of us to change the way we feel inside of us. And it can work, as you say, but short periods, and it can be to ultimate detriment of our physiology. And yet we can use this system, which sometimes we're in those unhelpful thoughts of thinking and feeling and creating disorder and disease. We can use that to our advantage and start to actually train the body, train the nervous system how to create more order. And I think, change begins in the mind, but it needs to be executed with the body. And so we need tools for the mind and the body to create sustainable change. And doctors, physicians, healthcare providers, we all need to experience this for ourselves and to know how it works and how it helps us. The better that we can support ourselves, the better that we can support our patients and our teams. So, I think we should teach this in school, but in medical schools, definitely, or any kind of medical education, and before they get, caught in the hormones of stress and they don't have time to leave the ward and sit down. And, I've done all that in the UK. The follow-up is so difficult, and I get it. Like, they're busy. Before they get caught up in that, it would be great to take them and integrate it as part of their education. They experience it for themselves. If they will experience for themselves that their outcomes are better, they're happier, their exam grades will be better because they'll be able to turn on their brain by doing these techniques. They'll be able to create what we call cortical facilitation. When they're stressed, you can't think straight. We all have those brain freeze moments. So actually their ability to execute will improve. Their clinical decision making is better. Their communication is better. The rates of error will be reduced. We know most medical errors are miscommunications that take place. So I think teaching, it's just a part of how we become as culturally. And if it becomes the norm, like it's just standard, if you want to learn how to use your body properly to like be an example of health, it's like you're saying, well, I don't read, but you should definitely read. I've heard that it's great.
I heard it's great.
It's like as simple as that. But for us, and I've been there myself, I'll raise my hand. I'll give advice. I will have given advice to my patients, like, you need to really take time for yourself. You need to relax. And I'm not. And there's a dissonance there. And how can I be an authentic person? And I'm depleted. And so I've been there. I know it happens. But if we can support an environment where it becomes normal, and they don't have to spend too long doing it. I mean, that's the power of this research. It doesn't take long to transform that. And so if your colleague is being more present with you and listening to you while you're giving them the history, and you're actually paying attention to them, you're actually having a more pleasant experience at work. You're more cohesive. The errors would reduce. You'd actually enjoy connecting with your staff members because I have more meaning and purpose, and I feel like I'm actually making a difference rather than I've just got to get through my day and keep my head down and just get out as soon as I can without making a mistake.
And then patient experience scores go up, outcomes, length of stays are reduced, meds are reduced. So one of the many cool things about Dr. Stanton, and part of my passion when I asked Maria, may I please Zoom with her? Because I want to support her. Will you just spend a minute talking about the division or the portal under Dr. Joe Dispenza that you are leading in healthcare? Because my fear was when I heard about this, and I'm like, those beautiful clinicians who are like, yes, please, then they go back to work and they're an outlier and they're weird because they're, exploring this work. I want to support Dr. Stanton so that that collective has the courage to keep showing up. And it's all about supporting those who are ready, not recruiting those who are not. And then Dr. Wolf, I'll get to you, but I want Carla to speak just a minute about her portal with healthcare workers.
Oh, yes. So because we've had so many people now experience the power of Dr. Joe's work, we've had more and more clinicians coming to his events and reading his books and being personally transformed. Just naturally, they started to come to us and say, how do I teach this to my patients? How can I kind of teach this to my clinics, my staff? And so there was a need. And that was the first thing that I thought when I came across Dr. Joe's work, like how did I not know this? How is this not taught? So we've had so many people register their interest within the community. And we just did a simple survey to say, hey, if you're a clinician, give us your information. Let's see if you want to learn some things. And like within 24 hours, we had 2,000 emails of like, they filled in this survey and they want to be part of it. And these are like high achieving clinicians. They are really top dogs who are just so passionate because they've experienced it. They've experienced the shift for themselves. So this year we just started a sister company of Dr. Joe's called Inner Health Coalition. And the idea is that we're bringing clinicians from across the globe together who are already experienced in his work, i.e. they've gone to a week-long event. And we dialogue about the root cause of disease, about how we can articulate these concepts to our patients better through the guidance of Dr. Joe and the research that we have from Dr. Hemmel. And so we now have, it's just started in May, so we now have 160 clinicians from across the globe. And we've shared with them the NCS training. We changed all the examples to be healthcare provider relevant. And it's been really so humbling to see how they've transformed when they've applied the work to themselves. And they say that I'm showing up to my patients differently now. And that's just like the goal to me, because their patients are now having a better relationship with their doctor, as you say, and they're just experiencing a much higher quality of care, of love, of outcomes. So really excited to see how that's going to evolve.
Well, thank you for your leadership. That's why it's just so heart-opening. Dr. Wolf, thank you for your patience. The floor is yours.
No, you actually just answered my questions, so I'll turn it into a statement. First of all, I can't thank you enough for taking the time to travel across the pond, as they say, and share your thoughts and insights. I mean, just listening to you, first of all, it just makes all the sense in the world. But it also, as I process what you've been saying this morning, all these connections and thoughts that I've had about some of the experiences that I see play out day to day across health systems across the country now make total sense. What I think resonates most with me is the data and the connection between how we show up, our decision-making abilities, and how I see that play out in hospitals day to day, by our nurses, by our physicians, by ancillaries, and how we do show up as professionals has a tremendous impact. As you said, on our decision-making. Are we making the right clinical decisions? Our patients perceive it. When we walk into our patients' rooms, they know right away what version of yourself is showing up. And so as you see our nurses and our ancillaries and our physicians in the environment that they're in today, which unfortunately is not going to change in the near future, although my dear friend David is working feverishly to help with that, those traumas that you reference that impact people are playing out repetitively with our workforce, to the point where we lost 25% of our nurses across the country since the pandemic. So I just have to reemphasize that I'm thrilled to hear that you're getting the response that you are, but maybe just talk a little bit more about how do we now then communicate this and message this in such a way that it becomes mainstream. With a few of us had a conversation last night. Wouldn't it be wonderful that if it was part of a nurse's shift, that every 4 hours she or he participates in some mindfulness, in some connection, so that after they emerge from that session, I'm now ready to go back and be the best version of myself so that I am making the best clinical decisions. I am being the best for my patient and their families. As a physician, I am being able to go into that next surgery, with a clear frame of mind. How do we, in your perspective, how do we get to where this is mainstream? That it's as go-to as David reaching for a Milky Way arm. I want to be. How do we get it so that it's mainstream? So that if I'm on a unit in the hospital or in my office, it's actually acceptable and expected that I pop into this space of reset. How do we get? Because like I said, what you said this morning, and I'm a physician, but not the background you have, it makes sense. So how do we get to that next step?
Yeah. I mean, I think there's a couple of things there, but the key ingredient is information. We have to make them think differently and realize that there is a constant connection with their thoughts and their physiology, and therefore their performance and their ability to be a good healthcare provider. And there is, and I know we were talking about this yesterday, there's something so hardwired in the identity of healthcare providers of their need to serve and their desire to serve and sacrifice themselves. And that works okay short term. Sometimes you just got to do it, and we've all done it. But if that becomes a cultural norm, and I can say in the UK, like, if you're not suffering a little bit, you're not a good doctor. Like you talk about how stressed you are. I mean, it's like, you can't say, I'm having a great day. I had this. Oh, what's wrong with you? You're not doing your job properly. So, so it's just normal. And so it's no wonder that when someone comes along and starts to say, I'm actually going to really pay conscious awareness of how I'm thinking and how I'm acting and how I'm feeling today. Because I know every time I have a thought, it makes a chemical in my body, and it's going to influence my physiology and influence how clearly I think and influence my clinical decision making. I'm going to go in the pod and reset. It challenges you, right? So, but if that became something that we just teach them, like, this is how, not suffering is not a way to be a great clinician.
Suffering is not sexy.
No, it's really, and it has been, right?
Totally.
It's like a badge of honor. And yeah. So we need to teach people that is just not cool anymore.
And we're gonna use Dr. Wolf as our meme. He's gonna be our mascot. Thank you for being here, Scott.
Thank you.
Miss Dawn in the back.
For being here. I am a therapist by training, so everything you're saying is not only refreshing.
And I'm the CEO of Collaborative.
Yeah, thanks. But everything you're saying is very validating. What I would love to hear, and a little bit piggybacking on Dee's comment, how do we interrupt the system, right? I think as a culture, we're very transactional, especially in healthcare. We reimburse based on billable hours. We reimburse based on someone being sick. We don't reimburse for prevention and awareness. And if we start reimbursing for meditation, I'll be back in healthcare tomorrow. How do we? The payers are starting to do more value-based, which is keeping people out of ED, and we're starting to look at wellness as more comprehensive. How do we break the system? And how do we? I think as a therapist, you always set these treatment goals that are very measurable because you want to get somebody out of treatment, right? That's the goal. As healthcare, it's not always like that. How do we break the learned behavior? How do we break the transaction to get to a more transformational system? And what is your thoughts on that?
Yeah, I mean, the physiological kind of paradox is that when you're constantly living in perpetual stress, it's not a time to change. It's a time to stick to the knowns, focus on the short term, be selfish. That is the physiological effect of stress, and that's kept us alive. We're now at a breaking point where that's not working anymore. We need to evolve beyond our primitive physiological response. So simply by starting with showing people, teaching people, and this is where the heart math techniques are really quick and simple, teaching them how to shift their physiology so that they can reduce the detrimental influence of stress. It will influence how they think. It will cause that cortical facilitation. It will cause the frontal lobe to switch on. Now they can think more integratively, more holistically. They're now seeing the dots connect. They can think more long term. It's safe. It's safe to create. This is about creating something new, right? And so if we're living in survival, we can't create a baby, we can't assimilate. So we need to teach people how to move into that state of creation. And just by shifting your physiology, you can start to open a window to that. And so that's why we think that some of the first steps is teaching people how to actually slow their body down and move into more of a state of coherence. Then from that level, we can start to give them the information. They'll be more receptive to change and they'll say, oh yeah, that makes sense. The frontal lobe is switched on, and they can actually integrate it. So teaching people about the influence of stress and how to change it, I would say, was the initial key. And then starting to give them information so they can really retrain, rewire their whole brain and body into a new person. And so if we can do that one individual at a time, and we have to maybe take the early adopters who are people who are ready for it and like, I've had enough. And sometimes, people who are perhaps out of work or taking time out of work because they've been so sick, they actually may be at the point of like, I've got time, I'm sick of this, I want to do something. But most of us don't believe we can do it because we don't believe we have the tools to change. But if we can just teach them the simple science, science is the language of like mysticism. We can actually explain the unexplainable with science. People get it. It's not woo-woo. Like, you've got pragmatic tools, right? So that's what we need, and that's what we have. So I would start with the simple stress, shifting their stress, shifting their physiology, then they're receptive to new information, then they can learn, then they can change. And that's the long term.
I want to respond to that real quick, and then I'd love to hear what you have to say. One of the reasons that I've chosen to be a resident partner here at Collaboratory, the space of innovation and disruption, is to be able to host conversations and workshops and mind pods and experiences for those who are ready to maybe make a shift. And then for me, the scaling is you all are the ones that are here, and then you tell two friends, and you tell two friends, and you tell two friends. So it's really through this collective workspace that we share, that you now lead, that I'm excited that we have an esteemed doctor from London who flew across to have this conversation. You guys are the ones that were taking the time to educate yourselves and look at the science. And yesterday at the Future Makers Breakfast, when under healthcare, the two top jobs that are needed are in mental health, right? And workforce development's all about mental health. And I'm sitting here going, well, if we get to root cause healing, we're all in charge of our own health and we don't need to fund those positions and so you guys are the ones that are going to help us scale this information. I would love to hear your reflection.
What I hear is when we make that choice, we can have success in this. And then it's our role to then push it down the line and tell two friends and tell two friends. What I think we see in different healthcare environments is that when there is that choice to invest, you see success. When it's pushed, right? And you say, you have to do this, you have to do this. The patient says, yeah, I know, but doesn't change. Yeah. So I think that, bringing together different areas, you can see success individually, right? So whether it's in Australia or in Africa, you see the success within that practice. But I guess my question is, have you had the opportunity to see success in a unit where you have one person that is radical, thinking outside the box, pushing the limit and says, let's try this, and then see that cascade? Because that's where I think you would see the most impact, if you will, in like one small area that becomes two, that becomes three within a health system or a school system or something of that nature. So have you seen that success yet?
Yeah, we are wanting to, because evidence is the loudest voice, right? 100%. So as you were speaking, I was thinking that we want to gather more and more evidence around how this ripple effect can take place. But absolutely, what we're starting to see is that if you can give people sound scientific information, then they will make a different choice. It's just that sometimes we have the intellectual information and awareness, and we are not able to articulate it yet well enough to our patients so that they get it. And so we need to have a language where, and it'll be different for different people. Now remember, if they're in survival, not a time to change, not a time to be receptive to new information, not a time to go to the unknown. So they, even if you give them all the sound scientific information, they may not hear it because they're the filter.
That you got it in medical school, so you weren't fried by that point in theory, right? Medical school is different everywhere, but if you get it early on, you can make those changes right away.
Yeah, absolutely. I mean, if you could start younger, then it's easier. It's an easier process, right? There's less internal programming of that resistance. But the hardest part about change is not making the same choice as you did the day before, right? So we can have all these ideas, but unless we can engage the body and actually do something with it, we apply it, we personalize it, we demonstrate it, then nothing changes long term. So we need to teach people, like, actually change. You will notice resistance in your body. This is normal. This is the process of change. If they can be aware of that and actually sit with it and know that when they feel uncomfortable because they're doing something new, that's progress, that's a victory, that's a discovery. Yeah. Then they will stop saying, well, and they'll stop listening to the conditioning of the past and say, this doesn't feel right, I'll start tomorrow, it doesn't work, which many of us have done, right? So it starts with that information. We have to be able to meet them where they're at and help it to land in a way that they get it and they have more meaning to what they're doing.
As well, and I don't know who they are, but you can go on the HeartMath webpage. So again, HeartMath is in hospitals around the world. So there are healthcare systems that are embracing that protocol for heart coherence. What's cool about this movement that we're currently hosting in under the Physical Space of Collaboratory is that we're not just taking HeartMath, but we're also taking Soul Happy and the visiting of the Mind Pod, and we're also taking Dr. Joe Dispenza's NeuroChange Solutions protocol. And so there's a sushi menu of offerings, and we have the esteemed Dr. Wolf, who flew in from New England to be a part and is introducing us to Innovation Hospital in Hartford and other areas. We've got Humana in the room. We've got some pretty powerful folks who are ready to, we have the VP of Wellness here in the room as well for Lee Health. So it's exciting, but we are very much, we're the disruption. We're the disruption. That's why there's, 30 of us, not 3 million. Thank you. You are, I don't know if you know how divine you are, because there are some of us who have been trying to talk about alternative ways of connecting with your own health for a while in this area, and it's hard, especially if you're not a physician. And you are a beautiful physician who has the courage to think different, to Gail's point, to reimagine. So crossing with you is really, really vital, and we are all here to support your work. I want to leave with one final thought before we shut down, and I think this is really important. We are responsible for our own health. And any tool that we choose to embrace for this reconnecting to the energy and emotions that are inside of us, that is just a tool. Our power is not in the process that we select. There are hundreds of pathways that you can select from to go within. But the answer is within, and it's individual for each of us. So please don't get hung up in the protocol that you put forth and give your power away to the protocol, because it's not about the protocol. It's about you reconnecting to you through the chosen protocol that you select. And those are my final thoughts for today.